Welcome to the Fibromyalgia Podcast. I'm your coach, Tami Stackelhouse, and this is episode 110. As always, every 10 episodes is an Ask the Coach, where I answer questions sent in by you, our listeners. Today's Ask the Coach answers a question I know that you have asked yourself. When will we have some new fibromyalgia medication options? Are there any new medications? To answer that question, I've invited Dr. Seth Lederman, CEO of Tonix Pharmaceuticals, to talk about their current Phase 3 trial of their fibromyalgia medication TNX-102 SL. I've also asked Dr. Lederman to share how medications are researched, funded, and what the process is for gaining FDA approval and getting new medications into your hands as a patient. As always, the information in this podcast is not meant to be medical advice, and it's not intended to replace consulting with your own doctor or healthcare provider. Our goal is to provide you with information you can take to your providers to discuss what may be appropriate for your individual treatment. For instance, this new medication. Now, let me introduce you to today's guest. Seth Lederman, MD, is a physician, scientist, and entrepreneur, and the founder of Tonix. Prior to Tonix, Dr. Lederman founded Targent Pharmaceuticals, which developed late-stage oncology drugs. Prior to becoming a biopharma entrepreneur, Dr. Lederman served as an associate professor at Columbia University for 2 decades and directed basic science research in molecular immunology, infectious diseases, and the development of therapeutics for autoimmune diseases. In addition to his research, Dr. Lederman served as an attending physician in the Edward Daniels Arthritis and Autoimmunity Clinic on the medical service at Columbia Presbyterian Hospital for several years. Dr. Lederman earned his MD from Columbia University's College of Physicians and Surgeons and an AB from Princeton in chemistry cum laude. Enjoy my interview with Dr. Seth Lederman, and remember to stay on after the interview for our listener shout out and additional information. Hi, Dr. Lederman. Thank you so much for being on the podcast.
Thank you for having me.
I am so excited to talk to you. One of the questions I get often is, when are we going to have some new treatment options for fibromyalgia? So I was excited to get the email that you guys are working on something. But before we dive into that, I always like to make sure that my listeners we're all on the same page. And so I'd like to start with just, how does one go about creating a new medication? What's that process? What's the approval process with the FDA, research, all of that? Fill us in.
Sure. I am very familiar with it because I've taken this particular drug that we're working on from start to finish. And it's a long process. It starts with phase 1. Excuse me. I'm glad you can edit out my...
Just start with it starts with phase 1.
Well, it actually starts before, okay, I'm going to start now. Okay. The process to develop a new drug is a long process. It starts with animal testing, approval to do a phase 1 study, which is the first in human study. And then phase 2 is where the drug is tested on people with the condition. And then phase 3 is where you're doing what are called efficacy studies, where the studies are large enough so that they're designed to satisfy FDA that the drug provides benefits that outweigh the risks. So it's a very long process. Thinking about this program that we're working on, I've been working on it for almost 25 years.
Oh, are you kidding me?
It's taken a couple of iterations and it keeps getting better and stronger, but that is how challenging it is. And it's also very risky. But my story starts with I was a professor at Columbia Medical School in the Department of Medicine and in the Division of Rheumatology, and I saw fibromyalgia patients and took cared for them. And a colleague who was actually from Johns Hopkins proposed this idea to me, and together we worked on it for a while, and it's been the basis of now two different companies as we continue to pursue the idea. So there have been starts and stops, there have been twists and turns, but it's a very long process.
Yeah, 25 years. No wonder it takes a minute before, when you read these interesting articles that come out, oh, scientists have discovered this about fibromyalgia, and then it seems like nothing happens. But it sounds like maybe things are happening, just not where we can see them.
Yes, I mean, I'm, as I mentioned, a doctor, but I'm also a scientist. I was a professor, and now I'm a drug company executive. But I've always believed in bringing things to patients as quickly as possible. The only way you're really going to know if a drug works is to test it in patients. And, we've been doing that for many years now. And in the process, improving the product and refining our ideas and the dose and many other things.
That's great. That's great. And of course, we want it to be safe, right? What is the biggest challenge that you have in that process? Is it hard to find people to test on, like study participants? Is it hard to find funding? Is it hard FDA? Like what's the challenges in that?
I think everything is challenging. But
Yeah.
clearly, we want to do right by patients who are, in phase one, it's volunteers because they don't even have any problem, and then in phase two and phase three, it's patients with fibromyalgia who volunteer to participate in our studies. The FDA has actually been very supportive. I think the FDA is a great institution, and there are experts on the FDA who know all about fibromyalgia. So that's I wouldn't call that a challenge. It's been very supportive interaction. But funding has been on and off a challenge, and that's related to the fact that when you work in a complex disorder like fibromyalgia, not every study works.
Mhm.
And it's hard to manage people's expectations and to keep the program alive. But fortunately, I think we're getting very, very near to a conclusion of our program. So even that investor challenge is becoming less daunting.
That's great. That's great. So let's talk about this new medication that you're working on, TNX-102 SL, and I'll let you explain it. But this is a new use of a drug that we've already had around, right?
Yes, the active ingredient of our new medication, which you correctly said is TNX-102 SL, the active ingredient is cyclobenzaprine, which was developed by Merck many years ago as a muscle spasm drug. And the brand name was Flexeril. And it was a tablet that people ingested 3 times a day, and it was indicated for short-term use for 2 to 3 weeks of use to relieve acute back pain. So we began using it or developing a product that contained cyclobenzaprine at a lower dose, so much less than 30 milligrams per day, and as a bedtime medication, because our idea is that by improving sleep quality, people with fibromyalgia see improvements in their symptoms. So,
Absolutely.
but
Yep.
in addition to that, oh, thank you. I'm glad you reaffirmed that.
Yes.
My clinical day. I remember the line. If you ask someone, "Do you ever feel better?" and it's not uncommon, they say, "If I can ever get a good night's sleep, I feel better."
Right,
That
exactly.
so what we're trying to do is increase the number of good nights of sleep that people have. There are some advantages to developing an old medicine in a new way, and that is that you can leverage to some extent the safety information and other information that people have already provided to FDA. But in the end of the day, when it's a very, when the drug has been in use for a long period of time, a lot of that has been done by methods that may not be the most modern or whatever. So we do have to redo a lot of things like that. But
Mhm.
the key thing that we've done is to make it a sublingual tablet. This is a tablet that goes under the tongue, and under the tongue, it goes into the bloodstream through the mucosal membranes. So it's actually called transmucosal, meaning through the membrane and gets directly into the bloodstream. So you don't actually have to swallow it.
So it goes under your tongue and then just dissolves.
Exactly.
Right. And I imagine there would be less side effects with that because you're not swallowing it, digesting it. Like it doesn't have to go through your whole body to do the thing it needs to do.
Yes. We haven't done a head-to-head comparison with the oral product, formerly Merck product. But we also expect that there will be fewer side effects because we're using it at a considerably lower dose,
Mm.
about 1/5, less than 1/5 of the dose that Merck originally got approval for. Now we're using it at a lower dose, but we have approval to study it for longer periods of time because the initial approval is just for 2 to 3 weeks. And fibromyalgia is, not going to get better in 2 to 3 weeks.
No.
We do see, we do see improvements in 2 to 3 weeks, but we're seeking approval from FDA for it to be used for longer periods of time.
That's great. What else is different about it? Anything? Just the delivery system, or are there other ingredients and things that make it different?
Well, the elements that make it different are that it is sublingual and transmucosal, that it goes right into the bloodstream. So in the tablet, and this is what's taken 25 years, we have continued to improve it in a variety of ways. And there's a lot of technology in this tablet. Uh, one of the When you have a drug, the active ingredient is called cyclobenzaprine, but there are what are called excipients in it and other things that aren't related to the therapeutic effect, but which help absorption. So we have a very sophisticated delivery system, and the delivery system, once the tablet dissolves, it favors this transmucosal absorption so that it bypasses the GI tract.
That's great. That's great. And I know you said that this is supposed to help with sleep, but there's quite a few things that go wrong with fibro sleep. So, can you talk a little bit more about that and how you specifically expect this to help?
Sure. Well, a big inspiration for me many, many years ago was Professor Harvey Moldavsky, who practices in Toronto, and he wrote some very important articles early on. One of them is where he took volunteers, college students, and he deprived them of sleep. And most of them developed some symptoms of fibromyalgia, not the whole thing, but it was pretty remarkable. Even in that original paper, there was one person who was resistant to developing fibromyalgia despite sleep deprivation. And that turned out to be a cross country runner, a college athlete, which I think is consistent with what many of us know, that if fibromyalgia patients can get exercise, it can improve the overall picture. But that implied that people who are in phenomenal physical shape are somewhat resistant. Although I think that I certainly know fibromyalgia patients who are in phenomenal shape and came down with fibromyalgia anyway, and I imagine
Right.
too.
Yeah.
But I think that there is some resistance that's implied. But let me go back to sleep. What I think the best term, and this is Harvey Moldavsky's term, for the kind of sleep disorder that fibromyalgia patients have is using the term unrefreshing sleep. So sleep that fibromyalgia patients may sleep the same number of hours, but they wake up feeling unrefreshed. And I think that that's essential to understanding, and it's essential to the mechanism of fibromyalgia, because for people that who do not have fibromyalgia, the sleeping process is something where the brain is able to do kind of a reset, and it's able to reset, in particular, the pain perception system. And I think a growing body of work indicates it's this pain perception system that is perhaps the biggest problem in fibromyalgia. And if people are getting unrefreshing sleep, then that tends not to do its work.
Right, right. As one of my clients said, I sleep and sleep and sleep and feel like I never slept.
Exactly. That is that is nailing it, right? That is nailing it. So yeah, so I think that related to that, we had to look for different kinds of medicines that would treat this particular sleep problem, as opposed to the more common problem when people say they have insomnia. It usually means they can't fall asleep.
Mhm.
So drugs like Ambien and Lunesta, which are obviously the trade names, but those drugs are really designed to make people fall asleep faster, but they're not designed to improve the quality of sleep and to build on that refreshing nature of sleep. Now we don't know a lot about sleep, so our our view that, for example, our product improves uh, refreshing sleep is based on the fact that we've done trials and people say they've slept better and that they feel better the next day, and the fact that giving a medicine that basically is designed to improve sleep quality, we're finding that there are benefits outside of sleep quality, including in pain, fatigue, and other areas.
Absolutely, absolutely. Do you know if it increases the amount of deep sleep or so one of the other things that happens with fibro is that alpha delta sleep, where we get alpha brain waves and delta sleep. So do you know how it improves sleep?
Yeah, I wish I could say that I knew more. We did work with, and actually, alpha intrusion was something that was identified by Harvey Moldavsky, and we did a
Mhm.
study with him on an early version of this product. It was a phase 2 study. It's in the literature in the Journal of Fibromyalgia, the Journal of Rheumatology, and we got a mountain of data from that. We had 36 patients, half were on our medicine, an early version, and half were on placebo. And I recall we did 6 sleep studies over the course of the study, and all of that goes into a computer. The files are enormous, and it wasn't it wasn't so easy to interpret. We did
Yeah.
the paper shows that we improved some signatures of improved sleep quality, but let me also say that we plan to go back to these kinds of sleep studies when the technology gets better. And by better, I mean, I think the future of those sleep studies will be people wearing essentially like a ski hat, with the sensors in it, and wearing it at home for multiple days at a time. And now the computers are so much better, this data can be analyzed, automatically, and there can be more data. The challenge with the kind of study that we did was, while we did, I believe, it was 6 studies over the course of this study, the problem is that when we did the studies, that meant that the patient volunteers had to spend the night in a sleep study room, which is a highly artificial environment. It's not
Yeah.
their usual things around them. And so you get six snapshots that are not, that may not be representative of how they're sleeping at home. And I think that's the promise of having this more, it's basically called ambulatory EEG, or the term for sleep EEG is called PSG, polysomnography. But I think that as that kind of data gets richer, we'll be able to see things. But I think it's fair to say that right now there is not agreement in the rheumatology or the sleep physiology communities about what non-refreshing sleep looks like in these studies, and what kind of improvement we'll see with drugs that improve fibromyalgia symptoms.
Yeah, because a lot of that really is in the eye of the beholder, so to speak, right? The patient who wakes up feeling refreshed or not.
I agree. I think the most important measure of any symptom is the patient's report. And I think that the FDA and other regulatory agencies have moved in this direction more and more, where the patient is at the center. And for conditions like fibromyalgia right now, we have to rely on the patient's subjective reports. And, even if it's called a clinician, assessment, the clinician is getting their information mostly by speaking to the patient and getting the patient's report. So yeah, the patient is at the center of it. And I agree with you. Right now, the state of the science is that the best judge of whether sleep was refreshing or not remains the patient themselves. Over time, maybe with sleep EEGs, maybe other technologies improving, there may develop objective measures, but right now I agree with you 100%.
So, what kinds of things then are you seeing with the patients? What kind of results? Obviously, we're improving sleep, but do you have any numbers or statistics or things like that that you can share, or are you even at that point?
Sure, we're very far along. We have one positive phase 3 study that we've reported. And to get a drug approved in the United States, typically a company needs two positive phase 3 studies. So we were very excited about the first study, being positive, and that had a p-value of 0.01, which is good. The threshold is 0.05, and you have to be below that in order for it to count as a pivotal study. So we were very encouraged by that. Then we did a follow-on study to confirm those results, and we were disappointed that at the midterm analysis, the study did not look encouraging. So we decided to stop enrolling new patients and then look into what we got. We were disappointed that we had to, essentially make this study smaller than it should have been. And we were particularly disappointed since we've subsequently looked at the study and projected, now that, projection is what it is. We project that if we had enrolled the full number of patients that we had planned to enroll, the study had a very good chance of being positive. So what happened? Well, we think what happened was it was during the Delta wave of the COVID pandemic,
Oh,
the study. And one of the activities of our drug is in about a third of patients, there is at least once during the study. So this is a 14-week study. Medicine's taken every night for 14 weeks, right? So 7 times 14 is 98 days. So looking back on it, we're disappointed that we missed that study. We and patients have lost, 3 years. That result was in the summer of 2021. And now, it's almost, we're expecting top line results in the fourth quarter of 2023. So, 2.5 year delay.
mhm.
But we're optimistic about the current phase 3 study that we're conducting. that we will report before the end of the year.
That's great. And yes, I totally remember that time. That was those were some of the symptoms, like, ooh, watch out for that. If you lose your sense of taste, talk to your doctor. You could have COVID, like, all those things. So I can definitely see how that might throw a little bit of a wrench in the works.
Yes. But nonetheless, we're grateful to the patients who participated in the study, because at that time it was also terrifying to leave your house to go to an appointment. We had to modify the study so everyone was wearing masks, and there was PPE, when they were evaluated. So it was a very challenging time for everyone, and I'm really grateful to the patients who participated. And we just have to go back and do the study in more normal times, which we've done. And we're looking forward to the results now before the end of the year.
That's great. That's great. And so then what's next? You said you're in the middle of another trial. Are you enrolling new patients? Do you have what you need?
Yeah, so we're still enrolling patients, and if listeners of the podcast are interested, there is a banner on our website. Our website is www.tonixpharma.com, Tonix, and then pharma is pharma.com. And at the homepage, there's a banner across the top that says recruiting patients in the study. And if someone clicks on it, then enters some information, their zip code, the rest of it, they could find out whether there is a study site close to them if they were interested in participating. But but that study, we reported in December that it was more than 50% enrolled. So I think you can imagine we're getting very close now to the end of enrolling. But then once someone is enrolled, they're followed for 14 weeks. And then, as I said, expect to report the top line results before the end of the year.
That's great. And so then what happens?
Well,
I'm going to keep asking you, then what? Then
sure,
what?
That's fine. That's fine. You have a right to be as excited as I am. There hasn't been a new drug in fibromyalgia since 2009.
Yes, long time.
There's been growing, I think, dissatisfaction with the products that are already approved for a number of reasons. But yeah, so then with a positive result, we would prepare to file the new drug application, which would be filed, I'll call it the middle of 2024. And, then approval from FDA would take about a year. So we would expect that with a successful result in this study, the product would be approved and available to patients in 2025.
So we're still talking another couple of years, which is better. I mean, than what that'll be 27 years at that point. So
Yeah, you have to start somewhere, right?
yes, exactly. And so once that then is available, would patients then just be able to go to their doctors and say, hey, I heard about this new medication?
Absolutely. Yeah, that would be the goal of an FDA approved product. It would be a prescription drug. People would need a prescription from their doctors to get it, and then it could be filled at a pharmacy or mail order pharmacy. But yeah, we're definitely designed something to be accessible to people, that would, could be in a prescription bottle, and good stability, and for the most part, there's good acceptance and tolerability of the product.
And you noticed it was just something that would like come on and then go away, like maybe one of the times they took it, kind of a deal, or yeah.
Correct. Exactly. So the terms would be, it's transient, so it lasts a short time, self-limiting, meaning it goes away on its own. And yeah, it hasn't been a substantial problem for
No.
the vast majority of patients.
Yeah, that's not anything that would keep me from trying it for sure. That's a pretty small deal. So, and if it helps you feel better, that would be totally worth it. So
Yeah, it's not an opiate. It doesn't work right away. It takes about 2 weeks, 10 days to 2 weeks to start for people to start experiencing the benefit. But the benefit of improved sleep starts earlier. So we think that also, the timing of it makes sense, that people are getting the improved sleep first, and then they start to see an improvement in their symptoms.
Yeah, absolutely, absolutely. And we definitely know if we can improve sleep, then so many things improve, right? And not even just fibro symptoms, but just life improves, right? Anxiety, depression, blood pressure, right? All those other things improve when we get better sleep. So I think that's great. Is this going to be something that is specific for fibromyalgia, like Cymbalta or Savella or those 3 FDA-approved meds, Lyrica being the third?
Yes, we're seeking an approval for the management of fibromyalgia. So all of the patients that we're recruiting in our studies, meet the criteria for fibromyalgia, and the primary endpoint is a decrease in widespread pain. I know that fibromyalgia is more than just widespread pain, but that's the endpoint that FDA has accepted for Lyrica, Cymbalta, and Savella.
Great. That's great. And the thing that I love about this, that those meds don't do so much, is that because we're improving sleep, it has the potential of improving brain fog and fatigue, which, that's been some of the challenges with some of the other meds is sometimes it increased brain fog and actually made it worse. So I don't know if you have any numbers on brain fog for your study participants.
Yeah, thank you for asking. So we look at all of these outcomes in our studies. Not all of them. We have not focused on what you call brain fog. The official name is cognitive dysfunction.
Yep.
We haven't focused on that because there aren't good measures. But we have looked at sleep quality, and the subjective reports of sleep quality are that it improves. Now, it's not the primary endpoint of the study, so I should say that it gives a numerical improvement. Excuse me, and then we've also looked at, for example, fatigue, and there's a numerical improvement in fatigue. We've also had good results on the FIQR, the Fibromyalgia Impact Questionnaire. So we think that the drug actually performs better if at the syndromal level. If you think about fibromyalgia, all of those elements,
Hmm.
rather than just widespread pain. But
Right.
we're delighted that there is an endpoint, and we think that widespread pain is a reasonable one, and we're all for the way that FDA regulates fibromyalgia drugs. But so it's just that's the hurdle. In order to get a drug approved, it has to work in widespread pain.
Right, right. So that's like the finish line that the FDA has set. But as a fibro patient myself, it's so much more than pain. Sometimes pain is almost the least important factor. Some of the people that I've talked to, fatigue is so much a bigger problem, right? You can push through pain, but if you're exhausted, you can't do anything. Right? So I think that's great. That's great.
Right. But I think from a regulator's point of view, I mean, they have to start somewhere. So
Exactly.
I think
Yeah.
pain is good enough, and I'm glad we have an endpoint, because that's one of the things that, for long COVID is an issue right now. Is there's no agreed on endpoint, and you I think this, but for the listeners, we've written about this. We're taking the view that about 2/3 of long COVID patients, we believe, have a syndrome that may as well be fibromyalgia, that it overlaps strongly with fibromyalgia, et cetera. So we've actually done a phase 2 study, enrolled about 60 people, and we treating them with our fibromyalgia medicine, and we expect to report data from that study next quarter. It won't be a big enough study, probably to count for one of the 2 studies for FDA approval, but it will give us an idea about how big to make those future studies, because it will give us some information. But we think that long COVID basically is fibromyalgia. for 2/3 of people. There's another third of long COVID patients who had a heart attack, a stroke, or got diabetes after COVID. So we put them in a slightly different category. And we call the 2/3 group fibromyalgia type long COVID.
Ah, interesting. I hadn't heard that. I know early on when, before we had diagnostic codes for COVID and things like that, I talked to lots of people who said, my doctor gave me the diagnosis of fibromyalgia because we don't have anything else to call this. So, yeah. And there is some differences with long COVID with, lungs and heart and stuff like that, like you mentioned. So,
Right.
yeah.
I would put those in a different category. I mean, and
Yeah.
I think all of the people studying long COVID, all is a big word, but
Right.
most of the experts studying long COVID agree that they should be segmented because there's certainly subpopulations, but we think that the fibromyalgia like long COVID is the biggest group, about
Mhm.
2/3.
And with so many people having COVID and then such a large percentage developing long COVID, that means we're going to have lots of fibro people out there.
Yeah, and actually, a professional colleague, professor at University of Michigan, Dan Claw, Clauw, in 2020, he's worked on fibromyalgia like me for more than 30 years. Actually, he's worked on it, as a professor and as a thought leader much more productively than me. I don't mean compare myself to him in that way. He's a very famous investigator and
Yes,
scientist.
he is.
But he wrote a paper, an editorial in a rheumatology journal in 2020, and predicted that this epidemic of COVID would be followed by essentially an epidemic of fibromyalgia. And I think that that was borne out. But hopefully now the rates of COVID are going down and the rates of long COVID have decreased. So hopefully, well, unfortunately, we're left with huge number of people, affected by it. But I think there's another interesting element to it that we believe that fibromyalgia can be the result of a number of different stresses. And actually in many cases is the culmination of a number of different stresses that at some point push the patients over a line and then, they have fibromyalgia. But there is a lot of talk now about grouping long COVID into a group of post-infectious chronic pain syndromes. And I like that idea, and I agree with it to some extent, but I think that calling it post-infectious is too limited because I think that, that's just one of, you can have hormonal stress, menopause, you can have, physical stress or traumatic stress. There are many paths where fibromyalgia patients can be stressed beyond the point of to the point in which they get fibromyalgia. And I think post-infectious causes are an important one, but not the only one.
No. In my case, I developed fibromyalgia after working an extremely stressful job, 9 years of, stress work environment. And my body was just like, yeah, we're done. And I've also talked to so many people who developed fibromyalgia after a car accident or, something like that. So yeah, yes, there is that group that is definitely, post-infection, but a lot of us aren't. So, yeah. So what else are you working on anything else? Are you aware of anything else that might be coming down the line for us
Sure. So
that
first
you
of all,
can talk about?
yeah, I'm happy to talk about it. It's been quite a journey with TNX-102 SL. So I, I appreciate the question, but I hope you'll share with me in some humor. I just told you I've spent 25 years working on it.
I know.
Are you doing anything else?
Or are you done?
Yeah. No, I'm far from done. No. As a matter of fact, we've recently talked about another drug we're developing. It's under development for depression. That's our lead indication, but for completely different reasons, we believe it could have activity in fibromyalgia. So we are gearing up for that. It's based on a completely different medicine. The active ingredient is called tianeptine. And there actually has been a small study already, not by us, but by another group, showing that tianeptine could have positive effects in fibromyalgia. So, given my, at this point, lifelong, career long interest and passion for doing something for fibromyalgia, we will be very excited to try this medicine in fibromyalgia.
Ah, very cool. Where is that then in the process for, actually getting out to patients?
Yeah, well, that's in a phase 2 study in depression, and I can't even project for you how many years it will be before it gets approved for depression. But then fibromyalgia will be lagging behind. But I think it acts by a completely novel mechanism, and I think it could be an important drug for fibromyalgia. But there's certainly years of testing before that gets through.
Sure, sure. And so that just brought a question to my mind. If you go through and have it approved for depression, do you have to do the whole process again for fibromyalgia or just pieces of it?
Well, you just pieces of it, I think, would be fair, because if you're using the same dose, then the safety information, other things that you've collected for depression can be used to support the development for fibromyalgia. But in terms of the clinical studies for documenting efficacy, you are starting all over. I mean, if
Right. As far as what you're measuring the result, right?
yeah, yeah.
Yeah.
But it's important.
Yes. Yes, it is. And it's important that, we have people like you that are continuing to look for new answers for us. So thank you for the work that you do. All 25 plus years of it.
And I also want to take all the credit. We have a team of phenomenal scientists, doctors, clinicians at Tonix who are supporting these studies. But yeah, we're very excited to be this close to the end of 102 SL.
That's awesome. That's awesome. So if you could say something to our listeners, just kind of talk to them directly for a second, what do you want them to know?
Well, since we're talking about these 25 years, I just want to say the past 25 years have been revolutionary for fibromyalgia patients, and I expect the next 25 years, the progress and treatments and other things are going to come even more quickly and be more fundamental, because we really are getting a handle on what is wrong in fibromyalgia. I think a better idea about how to treat it. So I think the future is getting brighter and brighter. And looking back on the early days when I was a fellow or a young attending, there was a lot of fibromyalgia patients were immediately treated with distrust. There were a group of doctors and other healthcare providers who would say things like, fibromyalgia doesn't exist. And you just don't hear that anymore. So I think there's so much positive happened. 3 approved medicines. I think the 3 approved medicines were huge breakthroughs for fibromyalgia patients and for the recognition of fibromyalgia. So we've come a long way, and now we just have to stay focused on use all the new learnings to make better treatments.
That's great. That's great. Well, thank you so much for being here, for sharing all of this with us. And I would love to have you let us know when we can all celebrate, when we can go to our doctors and say, gimme.
I will certainly keep you up to date on that. And thank you very much for having me on and for your interest in what we're doing.
Absolutely. And that wraps up my interview with Dr. Seth Lederman from Tonix Pharmaceuticals about their new fibromyalgia medication, TNX-102 SL. If you are interested in participating in the Phase 3 trial, Tonix is accepting study participants at the time of this recording in June 2023. If you're interested, just go to today's show notes. We will have a link where you can apply to join the trial. Just go to fibromyalgiapodcast.com/110. We will also have links where you can learn more about TNX-102 SL and the earlier Phase 3 trial results that Dr. Lederman talked about on that same page, fibromyalgiapodcast.com/110. Dr. Lederman has promised to keep us posted on the Phase 3 trials and will let us know when the medication will be available to you as a patient. I also want to invite you to join us at our next live Fibromyalgia Stories of Hope and Healing event, which will be held on Saturday, July 22nd. This is a free event where I will be interviewing 7 of our graduates about how they have improved their health and their fibromyalgia over the last few months. I know you're going to get new ideas from them in this. We are going to be sharing excerpts from the event on the podcast, but if you want to hear the whole event, you'll want to register. We'll have the link in today's show notes at fibromyalgiapodcast.com/110. And now I've got this week's listener shout out for you. This comes from a listener who reached out to get matched up with a coach. She had gone through our Find a Coach page, hadn't found quite the right person for her, and reached out for a little bit of help with matchmaking, which we were able to do. In her email reply to that, she says, "I am so impressed with how you all have supported me already. Thank you for helping me to figure out a plan. Thank you for listening and validating me. I really needed that today. And thank you for your podcasts. I've been loving all I'm learning from them. They have given me so much insight into fibromyalgia and given me a lot of hope. What an amazing, life-saving service you all provide." And that was sent in by Tami, not me, not spelled like me, but almost. So thank you so much for that, Tami. And I was so happy that we could get you matched up with the right coach. So if you have ever checked out our Find a Coach page, if you haven't found the right coach for you, feel free to send us an email. We would love to match you up with the right coach. You could go to fibromyalgiapodcast.com and look in the main menu for the Ask the Coach button. Just go ahead and click on that and let us know you need help getting matched to a coach. That wraps up this week's episode. I will see you back here next time.